Welcome to the 2020 virtual conference on MHM in schools. We're streaming live this morning. I'm here in New York in my home office, as I'm sure many of you are. Though we've been already in many virtual conferences this year, this event always brings together many people from around the world. This is our 8th virtual conference and the 4th straight year that we're having more than 1,000 participants from around the world. On behalf of UNICEF, I warmly welcome all of you here today. So right now, children's lives are being disrupted as a result of the COVID-19 pandemic, whether it's from closed schools, whether it's closed workplaces, stressed healthcare systems. This crisis is touching really every corner of our society. The Secretary General's policy brief in April reminds us that across every sphere, the impacts of COVID-19 are really exacerbated for women and girls by virtue of their sex. This also applies, of course, to menstrual health and hygiene. Girls and women may lack access due to normal supplies and services or changes in prices, increases due to disrupted supply chains. We know that certain groups of women and girls may face greater hardships, such as those who live in areas that have been locked down, in quarantine, or in self-isolation. Also, because of price increases, this may affect those with limited resources the most. And of course, we need to remember the women and girls who are on the front lines of this crisis, who may be healthcare workers or others who continue to serve during this time. It reminds us that wash services are such a foundation of both health and dignity. And water and sanitation and hygiene are, of course, both critical and essential to menstrual health, but also part of the COVID-19 prevention activities for really stopping the human-to-human transmission. But as we rise to the challenge of our new reality, we must be innovative. And I think, if anything, crisis calls us to find new solutions, even to problems that existed before the crisis. And I think this is why we're so happy this year to be able to have chosen the theme around innovations in menstrual health and hygiene, and particularly focusing on girls in school. So I really look forward to hearing from all of our presenters this morning, sharing your innovations for women and girls. And thank you so much for joining us today and continuing to support the work that you're doing on menstrual hygiene and health. Periods are not stopping for the pandemic, and we all need to continue to step up to this challenge because we know this isn't the first pandemic, it's not the last pandemic. So it really gives us motivation not only to keep going now that we're responding to the crisis, but also as we look at building back better and really reimagining a future where simple things that like menstrual health and hygiene, hand washing, are parts of our daily life for everyone, everywhere. So I will close now and hand over to Patty Allman, my colleague at UNICEF, for her remarks on innovations in menstrual health and hygiene. So thank you very much, and I wish you a fantastic virtual conference.
Great. So Kelly, thanks so much. I mean, I'm so thrilled to be with everyone, and it's just lovely to see everyone who has joined us today. And I'm going to really pick up on that theme of innovations, because I think as Kelly really set us up, as we're living this new normal in COVID-19, as we're reimagining what the world can be for women and girls, what the world can be for the communities in which we're living. I think innovative solutions is really one of the core aspects that's going to allow us to live that new vision, that new normal. And I want to give you a little bit of a story of how we've been seeing this within UNICEF. So within UNICEF, about 3 years ago, we really looked at our strategic plan. We looked at our gender equality strategies, our gender action plan, and we have this word innovation, right? We have this word innovation as what we call our change strategy, what we call our core principle of programming. But when you really sort of scratched at the surface, the question is, what do we mean by that? What do we mean by innovative solutions to achieve programming results at scale? So what we decided to do within UNICEF is say, well, let's take advantage of this remarkable sort of infrastructure that we live these almost 20,000 colleagues around the world, and let's ask them. Let's say, of all of the components of gender equality that we're trying to achieve as UNICEF, which one of these do you feel, by looking through a lens of innovation, we're going to be able to achieve those results at scalable impact? And so we put out the challenge. We did an internal challenge to our UNICEF colleagues. And what we came back with, and I'm going to be perfectly honest, I was surprised. Menstrual health was one of the core aspects that our country colleagues thought it was really, if we looked at it through a lens of innovation, we would have game changers. And we asked our country colleagues, we said, don't limit, when you think of the word innovation, don't limit to just digital, right? Don't limit to just technology. Really think through innovative financing, look through innovation in the way we design our programs, in the way we monitor our programs, in the way we're designing systems strengthening of our programs. And it's been a remarkable journey to see what our country colleagues, in partnership with so many others, country governments, private sector, and most importantly, grassroots organizations who are at the forefront of delivering programs. And within that group, I really want to highlight women's groups, girls groups, youth groups, who are thinking that they live innovation. It's not just a buzzword or a goal within a strategic plan. So we've just been so blessed to see what has come from our country offices and partnerships with many others. And you're going to hear about those today. And you'll hear about it from a lens of innovative financing through digital technology designed with and for girls, but across all of the spectrums of what innovation really means. And I really want to take a moment and put it in perspective from my hat of gender equality. And 25 years since the Beijing Declaration for Women and Girls, which is where we're living in 2020, which was the moment where we said women's rights are human rights. We have this moment to really shift the needle. We've made some progress for girls and women over 25 years, but to be honest, it hasn't been enough. And innovation is one of the core components of an initiative called Generation Equality. And we believe that that is very much why we're having this as the focus today. I think this community is at the forefront of thinking in real terms, what does it mean to look at innovation as a change tactic, as a programming tool to achieve results? I'm very thrilled that you're going to hear from some of my dear friends today on the panel. You'll hear from Grand Challenges Canada. You'll hear from my former colleagues at USAID. You're going to hear from the African Coalition on Menstrual Health and Management, who I'm just so thrilled every time I get their email in my inbox. I just feel like they're leading things that we all should know about, and I'm glad we're going to have the chance to hear from them. You're going to hear from Case from Her. And then you're going to hear from an initiative that we've been doing with Duke University. And we're looking at this through this perspective of social enterprises, many of them women-led, how they're looking at innovative solutions. How can we accelerate their social business models to achieve results? So like Kelly, I just warmly welcome everyone. I look forward to hearing this conversation, and I'm going to pass it to I feel like I'm in a wash sandwich between Kelly and my dear colleague who I'm going to pass it to right now, Lizette Vergas. Thank you all very much.
Hi, thank you, Patty. Thank you, Kelly, for this great introduction into the world of innovation and women and girls. So we're really, really happy to welcome you all to what I would say an ever-growing conference online. I hope that you have the slides in front of you. So this year we have over 1,700 registered participants from, I think, over 120 countries, even beating last year again, where we were already happy to pass 1,000. Welcome to all of you. We hope that you're all safe and happy. So this year we will have again closed captioning to increase the accessibility of this conference. The captions are available in both English and French, and you can choose the language and turn them off and on at the bottom of your screen. This year, we are using Slido to track your questions. So if you're not seeing already the option on your screen, then you can go to slido.com and enter the password #MHM to start typing your questions to the presenters. You will see that you can vote your questions up in Slido, so please join in and do a like to the question of a presenter if you also had that question, rather than typing it again, because that's we will try as much as possible, and we have Brooke Yamakoshi who is doing that. We're trying to as much as possible to take the questions with the greatest numbers of likes. Kind reminder that Slido is not a chat box, so not type chat messages that are not questions for the presenters into Slido, so that we can stay focused on the excellent presentations and their work that's to come. However, if you want to chat and connect with other participants, we all see probably faces and names that we want to say be connected again with after a while, especially now we're working home. So we encourage you to join the WASH in Schools network on Yammer if you're not already a member there. That's a place where you can connect, share your work and your thoughts also on the conference. Thanks to all of you who joined the pre-conference discussions that took place also on Yammer. As always, we encourage you to tweet along with the conference on Twitter today using the hashtag #MHMConf, and you can also follow us on UNICEF Water. Now on to the agenda. In a moment I will hand over to Janita Bartel, our hygiene specialist, who will moderate our first sessions today. And so if we look at the program, we have three presentations in the first sessions, sharing work from the government of Sri Lanka and UNICEF, work from UNICEF East Pacific in Mongolia and Indonesia, on the period tracker, and the Criterion Institution in the Pacific Islands on trade finance. This will be followed by two discussants, Everest Kwasi-Komlan of UNICEF East and Pacific Regional Office, and Chelsea Huggett of WaterAid Australia. Both of you, thank you very much for staying up very late to attend this. And they will share their reflections on this first session. Then following that, we will have a panel discussion I will moderate on innovations in menstrual health and hygiene. We are very pleased to have panelists from the Case for Her, Grand Challenges Canada, African Coalition on MHM, and USAIDS. You'll see the presenters, Christina, Liat, Pulang, and Sylvia on the screen. We will then move on to the second block of sessions, featuring presentations from the Johns Hopkins University Bloomberg School of Public Health in Uganda and the Sesame Workshop in Zimbabwe. This also will be followed by two discussants, this time Radu Ban of the Bill and Melinda Gates Foundation and Gloria Lihemo from the UNICEF office, regional office in South Asia, sorry. And they will, of course, then also share their reflections on the second session. Following in the third session, we will hear an update from WASH United on Menstrual Hygiene Day, which is only 1 week away from today. And our closing remarks today will be delivered by Matthew Nash, the Managing Director of Duke Innovations and Entrepreneurship. We're very pleased to partner with him as Patty already indicated, and his colleagues through the Duke UNICEF Innovation Accelerator. So thanks again to all of you from all over the world, from all your different rooms and places to join this conference. And I'm handing over to the moderator for the first session, Janita Bartel.
Good morning, good afternoon, good evening to all participants. I'm thrilled to see we have over 1,800 participants from all around the world connected. Thank you for Kelly for highlighting not just the importance of addressing MHM needs, but even more urgently to address those needs during the current pandemic. Thank you to Patty for framing what we mean with innovation, and give us a first glimpse of the range of innovations and the range of topics we'll be looking at when we speak about innovation over the next 4 hours. Thank you, Lisette, for giving us a concise overview of the next few hours that lay ahead of us. My name is Janita Bartel. As Lisette mentioned, I'm the hygiene specialist at UNICEF headquarters, and I have the joy and the privilege today to guide you through the conference. A few housekeeping things. You should have, if you have any questions regarding the admin of the conference or questions to the presenters or about the conference, please don't hesitate to use slido.com. Some of you I've seen are already on the platform. You type into your browser slido.com, and then you enter the hashtag MHM, and then you're right there. You can ask a question, or you can also see the question that other people are raising, and you can rank those. If you like them, you don't have to ask them again. You just rank them up so we can answer those questions that are of interest for a lot of people. Also, please share any surprising news or ideas or important insights from the conference via Twitter using the hashtag MHMConference or MHM or hashtag menstruation matters.